Hi, Victory for Women community. My name is Jasmine, and I'm an education specialist at the National Hemophilia Foundation. For today's Victory for Women post, I'll be chatting with a special guest who's excited to be here and share some of her insight with us. May is Mental Health Awareness Month, and today we'll be talking about this important month with Dr. Mina Nguyen-Driver. Mina, do you mind introducing yourself and telling us a bit about what you do?
Yeah. So I'm a clinical psychologist and I've been practicing for over 20 years. And my specialty is working with patients and families with bleeding disorders. So in the HTC that I've worked at, I've been at the Arkansas Center for Bleeding Disorder for about a year now. But prior to that, I was at the Oregon Health and Science University at their HTC for 15 plus years. So both of the HTCs that I've worked at has been womb to the tomb, meaning that I see children, or like maybe even before that, moms who are pregnant and they know they're going to be having a baby with a bleeding disorder, all the way up to our older adults to end of life care. So I see it all, and I see all patients with bleeding disorders. So it doesn't matter what type, variation, and then it really just the age range just is varied as well. Yeah.
Great. Thank you so much. Thank you for being here and sharing a bit about yourself. I do have a few questions to get our conversation rolling, if you don't mind.
Yeah, sure. Sounds good.
Great. So our very first question here is, what does Mental Health Awareness Month mean to you? Starting off strong, pretty heavy question here.
Yeah. I appreciate that. I feel like what it means to me is that finally, that mental health has made it on the page. Like mental health is being recognized now. It means a lot to me that now people are seeing it as, yeah, this is a really big deal, and that there needs to be a lot of attention towards this. In general, though, Mental Health Awareness Month, to me, I would say, is all about reducing stigma and educating our public and our community about behavioral health and advocating for policy changes to support our patients and families. Millions of people in the United States are affected by behavioral health issues. And so it just means that we need more attention to the situation.
Yeah, great. Thank you for sharing. I'm glad you touched on the advocacy piece because I think that is such an important part of this month as well.
Absolutely.
Moving on to our next question here. What are some ways that people can participate in this month and help raise awareness?
Yeah, that's a really great question too. I feel like there's so many ways, and we all know like there's multiple ways on how to spread awareness. In our local community area, our cities, our towns, there's always going to be a walk, there's going to be an event. There are different associations or programs that will put on events for mental health awareness. I know my own work, my children's hospital is putting on something too. And I know that many other, even like HP or Hewlett Packard or like other large companies, low tech, high tech companies are putting on mental health awareness month. And so even like corporate places understand that there's a need for this. But I really think then a really great way, and it's easy and it's free and it's not difficult to do. Many of us are on social media. And so with Facebook and Instagram and TikTok and YouTube Shorts, all the different platforms that what we have around or that are around, is that we can post our stories. I know that NAMI, which is the National Alliance for Mental Illness, they have a campaign going on right now called hashtag More Than Enough. And you could just put it on your storyboard or on your Facebook page and just say, very simply raising awareness, just saying that like, I am more than just my depression, or I am more than just my anxiety. I feel like the more that we can tell our story, the better that we will be. If we can share like what we've gone through, you might help somebody else through their anxiety or their depression that they have going on. And so, again, I would say a lot of people are on social media. It's easy to do, and raising awareness that way. One of the quotes they have on the NAMI website was, "No matter what my depression tells me, I am worthy of love, I'm worthy of acceptance, and I'm worthy of fulfillment. I am hashtag more than enough." And so, again, just bringing awareness like that, it's just a simple 2 sentence that this person wrote, is amazing. And then somebody else can, hey, you know what? I'm not going to be alone in this situation, because if I know I can help somebody else, why not? Yeah.
That's great. Thank you. It's amazing seeing some of these stories and movements come to life through social media.
Yeah. Oh, absolutely. I mean, nowadays it's like, I mean, to be honest too, it's like my own kids too. They're teenagers and they're like, "Oh, mom, just guess what I heard on TikTok." And it's like, you know, again, you have to take everything with a grain of salt sometimes, that you hear on the internet and what you read and see. But I will also say too that there's a lot of great information out there that is on social media. So, if you have it, share it. And then, again, if you're an adolescent, talk about it with an adult, share it with a teacher or somebody that you trust, and making sure that you're getting accurate information from social media. But yeah, lots of great stories can come about
Yeah,
from social media.
yeah. Storytelling is such a big piece of this. That's great.
Absolutely.
So moving a bit more into the community that Victory for Women serves, I have our next question here. From your experience, how do mental health issues affect women, girls, and people with the potential to menstruate with bleeding disorders? And I have a bit of a follow-up too. What are some of the most common mental health concerns you hear arising from within this community?
Yeah. So um, that's a really big question.
Mhm.
I will start broad and then kind of narrow it down as we go. So I would say that the effect of mental health issues on our population is that there is significant exhaustion and stress and worry and fear, irritability, sadness, loneliness, lots of those feelings. Um, Really, what I hear from a lot of the women that I work with is that no one understands them, or no one can understand them, not their own girlfriends or not coworkers. Maybe the only people that can understand them is like their own sister or their mother who also had a bleeding disorder. And so it can be really stressful when you're keeping it to yourself, or if you're just holding that. But with all of that, when we experience exhaustion, stress, fear, irritability, anxiety, worry, all of that, it's going to affect our work performance, and it affects our home life, and it affects how we are as a woman, how we are with our friends, how we are with our significant others, our spouses, our children. So there's a ripple effect, like if we are experiencing these mental health concerns, it's like throwing a rock into a pond, and then we see all these ripples that kind of go out. And those are the things that we affect, not just on a micro level, but on a macro level, on a really much bigger level.
Mhm.
Um, some of the specific things that I often see a lot, I hear a lot and see a lot with my patients is that, again, just not being able to do what it is that they want to do freely. So, they would love to go on a walk with their significant others, or for even like adolescents, just being able to play sports or soccer again without getting massive bruises on their shins or around their body. And then people are like, "Oh, what's wrong with you?" Uh, without being teased. And even for women too, it's like being able to go on a hike and wear shorts and then not be embarrassed about maybe some of the bruises that are around their shins. And then people asking them like, "Oh gosh, are you in a domestic violence relationship or anything like that?" And being judged that way. And in general, we know from research too is that women are in general at risk at 2 times the risk of depression than males are. And so I think being conscious of that, and um, you know, during a woman's time in the month or even post pregnancy and being menopausal, um, are at higher risk for depression and anxiety. And so um, we want to just be aware that we women have this going on, and that's a huge stress to keep going on, and that uh, again, like some of my adolescents and my adults will talk about too, just a lot of embarrassment too, like sometimes bleeding through their tampon or their pads, or even double, they have tampons and pads on, and just that worry and fear. So lots of that going on.
Yeah. Thank you for sharing. I know feelings of like isolation, feelings of not being heard, we hear it time and time again in this community, and it's so disappointing. So thank you for shedding light on just like the mental toll that can take on one for like hearing that their whole lives, not feeling heard their entire lives,
Hmm.
effect on your mental health.
Absolutely. I mean, I think too that again, a lot of the women tell me that, when you have a bleeding disorder, sometimes you can have a period for 3+ weeks. Maybe you might only have a day or two of respite. And so again, there's just that constant fear or anxiety of like, oh my gosh, like I don't feel good about myself. I don't feel sexy. I don't feel like I want to wear that outfit, or I don't want to go anywhere for fear of like bleeding out, or I'm going to get a cramp. I don't feel well. I don't know if I'm going to have a clot, or bleeding out clots. So yeah, it's really tough.
Yeah. All right, moving on to our next question here. What are some ways that women, girls, and people with potential to menstruate in this community can carve out time in their daily lives to prioritize their mental health?
Yeah, great question too. I would say that not necessarily about carving out time for themselves in their daily lives, but really the idea is what I work with patients and families on is being in the moment, being here and being now, being present, like feeling your butt on the couch or feeling your butt on the chair, or feeling where your feet are on the ground. And so what I really try to work with our women and young girls about is practicing self-compassion. I think that's so important. We are so good about being critical and harsh about ourselves. We're so good about like self-deprecating. And I really want young girls and adults or adult women to feel like, no, you don't have to berate yourself. You don't have to be down on yourself. You don't have to be harsh or critical about yourself. That's not helpful. We're only human, and you have to give yourself grace. I think that's really important. So that's one. Two is I really believe in the art of journaling. I think journaling is so important. I feel like um, if you can get your feelings down on paper and no one has to read it, it's just only you, just put your pen down on the paper and just start writing. And it might just be a sentence, it might be 5 pages, but just write, and then close up your journal and then put it away. Sometimes that can just be really cathartic as well. Sometimes even as cathartic as talking to another girlfriend, or to your best friend or to your mom. Just put it into a journal. No one's going to judge you. No one else is going to read it. The only person is just going to be for you. And it's just you're putting down your vulnerabilities and your thoughts and doing that. And three, we know from research too is that if you don't eat well, if you don't sleep well, and if you don't get good exercise, you're gonna get yourself in a tizzy. And so when we're stressed out, we either don't eat or we eat too much. If we if we're stressed out or anxious, we either sleep too much or we don't sleep enough. And then when we are anxious and worried, we either exercise too much or we don't exercise enough at all. And really make sure that you get at least your 7, 8 hours of sleep at night. You're eating, we say eating 5 small meals a day, like, so you're not eating 3 heavy meals and snacks. You're trying to eat lightly all throughout the day and making sure that you're getting all your food groups. And then, our physical therapist would say, in terms of exercise, just move. You don't have to get your heart rate up necessarily, although, it is nice. It is good to be able to get your heart rate up for 30 minutes a day. But the fact is that like just standing up, like if you have like a work table where you can stand up and do your work there in your computer, or just stand up and then go for like a quick walk around your building or around your house, around your school, whatever that might be, that is a form of exercise too. And it can also be like a form of just like de-stressing, relieving some stress and taking your cool off too. And then fourth is, I would say, I always tell my patients and families that I want you to challenge your thinking. Are these distortions that you have about yourself really true? Is it really true that you don't look good? Is it really true that that you don't feel good about yourself? Is it really true? Who's telling you this? Our brains can really manipulate us sometimes, and it tells us things, and a lot of times it's not true. So I want women to challenge themselves. I want them to say, hey, you know what? I don't need to do this. Like, this is unrealistic. This is not helpful to me. I'm going to practice self-compassion and I'm going to move forward. And I would say last too, then like setting realistic goals for themselves, like sometimes like, as women, we want to do too much. We do too much. And so there's so many things that are on our list that we need to do. Hey, it's okay. Give yourself grace. You're only human. If you only get to one or two of those things today, it's okay. Break things down into smaller parts, right? Like I had a woman the other day say to me that like, oh my gosh, I'm so overwhelmed. I need to clean my kitchen because I have Mother's Day coming up, and it's like, you don't have to clean the whole kitchen all at once. For now, just start on cleaning your sink. Like if I have a clean sink, I'm happy. Like that's amazing. I got everything into the dishwasher, start with just the small thing and then work on to the next thing. Don't think of it as you have to clean this humongous kitchen. I always say to my patients too, like especially my teenagers, I always say, you never eat a hamburger in one bite. If you
Yeah.
think about that, you never eat a hamburger in one bite. Maybe some people might, but in general, you don't eat a hamburger in one bite. You take small bites, and that's the exact same thing about tasks that we need to do. Just take it one day at a time, one chore at a time, and then move forward with doing that. So I would say that those are the ways that people can carve out their time to take care of themselves.
Yeah. Thank you. That is beautiful. I know, very applicable to me. I was looking at my to-do list earlier, and every single time it's just so long. And I'm like, you know what? If I can get just 1 to 2 things done,
Yeah.
that's fine by me. Like I
Yes.
can give myself that grace there.
Yeah, exactly.
Great. All right. Up to our next question. So as someone who works in this field, what is one piece of advice you have for others that you wish you had heard earlier in your life?
Yeah, I'm so glad that you asked this question. I'm just going to share my screen really quickly. Can you see that?
Yes, I can.
So I really feel passionate about this. When I get asked to speak at women's conferences or adolescent women's girls conferences, I love sharing this slide. And it's taking care of yourself doesn't mean me first. It means me too, right? And so I think a lot of women feel like when they try to prioritize themselves, or they want to go get their hair done, they want to get their nails done, or they want to treat themselves to something, buy something. They feel like, oh no, I can't do that. My kids need new shoes, or my kids need a new T-shirt, or my husband needs to, he needs to get this new tool for whatever that is. And so we put ourselves in the back burner a lot. And so, what I say to women is that you need to prioritize yourself. You need to take care of yourself. And it doesn't mean that you're putting yourself first before your family. We're not suggesting that. We're not saying that at all. We're just saying that you are included too as part of the number one plan.
That is such a beautiful message. Thank you.
Yeah, you're welcome.
And then our very last question here today is, lastly, what is one topic within mental health that you want us to work towards destigmatizing and have more open conversations about this Mental Health Awareness Month?
Yeah, gosh.
If you could pick just one.
Yeah. I'll just put this out here really quickly that I feel like there just needs to be a lot more education about that. I think there's a lot of great information that comes out every day about mental health, but I feel like more and more information about mental health needs to come out there, especially just destigmatizing mental health in general. A lot of times when I meet with patients and families, I'll say, I'm a clinical psychologist, and I don't actually use the word mental health. I use the word behavioral health. Behavioral health and mental health are used interchangeably in psychology. And I hate to say it, but when people hear the word mental health, they think, oh my gosh, am I mental? And it's like, no, not at all. And so psychologists, like, we've tried to change the verbiage, we're trying to change the wording so that it's more of behavioral health. It's about how you feel and how you behave. And so, there's there's one camp that says, no, we should continue to say mental health. We need to destigmatize mental health. We need to say, hey, mental health is better health for people. Well, another camp might say, people don't understand mental health. We need to call it behavioral health. And so, I live on all fences. What I think is, like, the fact that we can talk about mental health and we can talk about behavioral health, and that we can, insurance companies are starting to recognize it and pay for mental health treatment and have therapists on their panels. A lot of times workplaces have it through their offices too, or through their HR program. I think that's important. So I don't know if I answered your question or not, but I just think that the better health leads to mental health leads to better health. And the more that we can work together as people, we will continue to destigmatize mental health, and people don't feel shameful about it and getting the help that they need.
Absolutely. You absolutely answered it. Having open conversations about this is such an important piece of this work.
Yeah, for sure.
All right. Well, thank you so much, Mina. We so appreciate you for being here, sharing a bit of your knowledge, chatting with us about the importance of both behavioral health and mental health, and most importantly, taking care of ourselves. I hope you all take some time to prioritize your mental health this month. Take care of yourselves, celebrate yourselves, be kind to yourselves, give yourselves grace, and thank you all for watching.